here. Thank you so much for allowing us to spend a little more time with you in the evening. Thank you so much, Danielle, for being here. Before we get started with tonight's virtual learning series, I want to introduce myself. My name is Toni Meyer-Cord. I am one of the academic managers for Aspen Dental, and we are honored to have one of our everyday clinicians with us in this VLS. What I'd like for you guys to pay attention to is the chat feature. If you have any additional questions, please put them in the chat. At the end of this presentation, we'll award the gift card. So I'm excited. With that being said, thank you for showing up for our Power Hour with Danielle. She is a hygienist with Aspen Dental. And I just want to open it up. Danielle, can you share a little bit about who you are and where you come from?
I'm Danielle. I've been a hygienist going on 7 years now. I've had, a few Aspen locations that I've floated around at. I started out at private practice and really fell in love with coming into Aspen. I started out just on Fridays and came on full time. About me, I'm a mom of currently 2 that are born and pregnant with 1 now. Being a pregnant clinician is a little bit different, but I love it. And I'm excited to grow with Aspen because it just opened so many doors for us.
Awesome. Well, thank you so much. And congratulations, Mama. I
Thank
remember
you.
that feeling too, like being preggers. Like I was a dental assistant though, but thank you for being here. I really appreciate it. I'm going to move on now with some questions just to kind of have you guys have just Danielle's brain to pick for being an Aspen hygienist and anything else in her wheelhouse. So, Danielle, just for you, can you describe a typical day in your role as a hygienist with Aspen?
Yeah, so typical day is I always get there. I'm a very atypical personality. A lot of us hygienists are. We like to have control over things, over our schedule, over our operatory, over how we run our schedule. So my day starts about 15 minutes before anybody else is getting to the office. So I can look over my schedule, make sure all of my patients have planned all the things that they need planned. Make sure we're not missing anything treatment wise, x-rays, oral ID, perio charting, 3D scan, any of those things. Then we go to a morning huddle where we can talk about those things. And then about start time, we start to see those patients to keep them on track. Make sure, we're trying to get those back on time because they set time aside to be able to come see us. And, their expectation, just like ours, when we go to the doctor, we want to be in there on time. We want to be at least seated in a chair. That's when the appointment actually starts. So we're seeing those patients, we're educating those patients, we're showing them their x-rays, their 3D scans, we're helping them keep things healthy. Through the day, we're, doing our notes as we see those patients. We're helping reschedule their next cleanings, keeping them on track. And then, through the day, we're trying to help with help those dental assistants. We're a team. So we want to make sure we're having that team atmosphere. When they need help, we try to help them. When we need help, guess what? They're going to come try to help us. So seeing that is really important, so that we keep that team atmosphere and we all feel like a family. We're spending 8 to 10 hours a day together. Super important to have that bond with them. So really a nice flow. You run your schedule. Your patients are your priority. You're stepping away occasionally to see some new patients, introducing yourself to them, checking their gum health, explaining to them why that gum health is so important and why, what the difference is between a healthy cleaning versus periodontal therapy, or what they know it as is a deep cleaning. So setting that expectation for them is really
Yeah.
important before they land in our chair.
Nice. Very nice. So I just want to back up a little bit. Tell me a little bit about your specific role. I know that you're in an office that has more than one hygienist. Tell me a little bit about your role and what that entails.
So my role, I'm a lead hygienist. So that doesn't give you like higher power or anything like that. It's more of a expectation. So the dental assistants will come to me first and say, "Hey Danielle, I have a new patient. Can you come introduce yourself to them?" That way they're getting, a consistency with who they're seeing in the office, and then I have that availability to be able to introduce Lori, or my new oncoming McKenna. And then my role also includes like ordering, keeping control of our budget and our stock, making sure that Lori isn't needing anything in her operatory that we're running out of, making sure, all the things for patient care are present so we can provide the excellent patient care that we provide.
Very nice.
Also includes like schedule auditing, making sure, looking a week out, that we're not empty, that we have patients scheduled, that we have room for infection patients, to make sure we're getting them in sooner rather than later.
Yeah, yeah, I like that. I love the whole thought of it. It's kind of like, the hygiene team just takes ownership, if you will, of the hygiene flow and the hygiene department. So I really like that a lot. I've
Yes.
worked alongside with other hygienists, and it's almost as if like you're still siloed. There's no real overlap. Maybe you kind of talk about some things, but we really didn't have as much autonomy as far as like making sure that we have everything that we need. We always had to go through another person. So I really like that. Thank
Yeah,
you.
we just make a list, and if there's something Lori prefers that I don't typically order, she just says, "Hey, I would really love to have this in the office. Can we get this on the next order?" And I'm like, "Absolutely. I'm always open for suggestions," because,
Sure.
she has been a hygienist, she's been an instructor, she's been in the dental field much longer. So always having a little bit of feedback is great.
Perfect. Thank you. So, inquiring minds want to know, what type of support do you receive from Aspen Dental, like in terms of administrative tasks and patient management? Do you get that kind of support?
Absolutely. So there is so much support and so many different people that we can reach out to. It starts with our territory, our hygiene territory leader, Joey. We can reach out to him, ask him questions. He gives us a lot of the answers, or he directs us to our homepage on Aspen and links us to direct policies or trainings or courses that we can take to be able to self teach, or
Yeah.
watch, to be able to know what we need to do with those tasks.
Perfect. Awesome. I appreciate you sharing that. And I know Joey, by the way, he's an amazing, and Joey's role is he is a TMHS, a territory manager of hygiene support. So he has an area, multiple like offices, and he helps to support and advocate for our hygienists. He's a hygienist himself. And so it's always great that we link up with people that totally understand the day to day for hygiene.
Yes, he is so knowledgeable. And if he don't know, he knows exactly who to reach out to get that answer for you same day. You're never
Nice.
waiting, which is spectacular.
Nice. I love that. So moving on, how does Aspen Dental ensure that you have the necessary tools? You kind of touched on it, and resources to perform your job effectively. I know that one of the things that was a big hiccup for me in private practice, and this isn't a slam on private practice, there are amazing doctors out there, is just making sure that I had what I need when I needed it, not necessarily when it was convenient for someone else to order. So, how does that work for you too to make sure that you have that?
So we have all offices have a standardized budget that we try to stay within. But the great thing about Aspen and always accepting new patients and always having room for more experienced patients and things, we have a rolling budget. So we're able to order literally within reason, whatever we want, whenever we want it. We can order our own instruments. We don't have to ask permission. We can order new Cavitron inserts. We can order a new oral ID if we need a new oral ID. Those, if our Cavitron breaks, guess what? It's going to be rushed overnight. We have those availabilities. We don't have to go through like an office manager or ask permission from a doctor. We have that budget. We know what we're able to spend, and we're able to get all the tools necessary to do our job effectively and efficiently.
That's awesome. Is that did you say it was like a rolling budget? So what does that
Yeah.
exactly mean? Does like one, like let's say you don't utilize part of the budget from, let's say, May and it rolls over into June? Is that what you mean with that?
No, so a rolling budget means that you have a set budget that automatically is populated from what you produced this month the year prior. So that budget is already set in stone, but the more the office produces, then the more budget you have to spend. So you just keep an eye on your numbers, making sure you're reaching that goal. And if you supersede that goal, then you have the money to replace or utilize to be able to get more electric toothbrushes, more Arrestin, new Cavitron inserts, because the more patients you see, the quicker you go through your instruments,
Right.
the quicker
Yeah.
they dull, the quicker they
Yeah.
they run out of oomph that keeps us able to do our job.
Perfect. Perfect. So speaking of that, like your patients, like can you describe like your average patient, like average age, like average dentition? Do you see a lot of perio? Do you see a lot of healthy gums? I know one of the things that we talk about is that we're strategic in where we position our offices because there's so much need out there. Can you speak a little bit to like the demographics of the kinds of patients that you see?
Yeah, so we do see a lot of patients that have perio, haven't been to the dentist in 30 plus years.
Yikes.
We see a lot of young patients that are, recovering addicts or current addicts that need, either periodontal therapy or full extractions. We see patients that have been smoking, 30 years and been to the dentist twice in their life and have never been talked to about gum disease. We see patients that have been going to the dentist, the same dentist for years upon years, and never been talked to about gum disease. Or maybe they're healthy. We see a range of literally everybody. Um, we don't see a lot of children. I think they stick with the pediatric office down the road from us, which I don't get me wrong, I love kids, but I'm thankful. I'd rather see a ton of perio patients, but that's okay. um, but we range. I think our one of our oldest patients is in their late 90s and has a full set of teeth. It's insane. So it's great. Our location is really fabulous. The newer location that opened up in South City has taken a lot of the patients that are of lower income and more addiction from what we were seeing. So in this last 6 months, we've seen a little bit less of that. But we do see a lot of perio patients. It's almost
Yeah.
hard to keep up with the amount of infection patients we need and our recares. So adding a third
Yeah.
hygienist is going to be a blessing.
Nice. It kind of goes to the point that we all know as clinicians that 3 out of 4 adults have periodontal disease to some degree in our country, which is kind of sad when you think about it. But the other piece is, you touched on it that sometimes people have gone to the dentist for years and years and years, and they aren't no one talks to them about their periodontal health or actually their disease. And so usually you become the bad guy when you are the one to have to say, hey, listen, I've used all these tools and this is what's indicated. I can show you, I've done a scan, I can show you everything. And what is critical here is that oftentimes I think even just personally, I was put in positions where I was, just clean their teeth. And it's like, no, they don't just need a cleaning. And it's like almost like a forced thing, like, yeah, you just do what I ask you to do, which reduces our licensure and our scope. So I appreciate it sounds like that Aspen Dental clinicians, use high standards. You're able to do your dental hygiene diagnosis, and you sound like you get the support of the doctor. How much do the doctors rely on the hygiene team to give them the information about the periodontal health or disease of their patients?
100%. Our doctors will do a perio chart if it's absolutely needed. If we are running behind and being crazy, they will support us. And they are fabulous at it. But they would 100% prefer that a hygienist goes in there because they know that that's our specialty. That is
Yeah.
what we went to school for. That was my doctor compares it all the time. He's like, that's like me telling you to go in and prep a filling for me and I'll come in and fill it. He was like, that's just not your scope. He was like, hygiene is not my scope. I need you to educate this patient. Not that I don't know how, but I don't know how to connect with them on your level. On a hygienist level is totally different than
Yeah.
what a patient looks at as a doctor. They're looking at them as the money maker. They're looking at them
Gotcha.
as the one that wants to collect all that income from them. They see us, it's a lot different. They know that we're there to support them, to show them, to help them, to educate them. So our doctors really 100% depend on our diagnosis and support it 100%. They do not question us. They know that that's our scope and they never overstep us.
Yeah. And so what she's talking about is the dental hygiene diagnosis. If you are a member of the American Dental Hygiene Association, you'll see it all laid out that there is such a thing. We are not like trying to diagnose like every little thing. We're not diagnosing all of these things. We're taking all of our education and we're saying this is what it's presenting like. And we collaborate with that doctor who says, yes, this is exactly what that is. And that's how that goes. There is such a thing. I know that that's been something where, hygienists can't diagnose. And it's like, well, why did we go to school to learn about how to identify health and disease if we cannot say that it's healthy or diseased and have that support? So, yeah, thank you. Moving along here. Can you share how Aspen Dental supports your continuing education and professional development? And this is something that I know is important because each state is different with how they deal with their continuing education for us to keep our licenses. And oftentimes the events are pretty costly, right, Danielle?
Yeah. So we have a whole website that is designed specifically for Aspen employees. It has their like links are on that page, on that homepage that are labeled continuing education. And there are specific columns for specific licensure. So hygienists have their own link, doctors have their own link. We also collaborate with our POPs, our owner doctors, and a lot of times they will pay for us to go to courses.
Oh, nice.
Yeah, so we have been I think 3 years ago, our POP paid for us to be certified with laser. He also sent us to the Missouri ADH conference last September,
Yeah.
where we were given all of those continuing educations. I think I acquired 12
Yeah.
continuing education hours that weekend, which is
You were just
amazing.
shy of you were just shy of 2. I was the vice president for that meeting. So you were just
Yeah,
shy of 2. I think the total was 14 hours.
yeah. So
Yeah.
I think I hit almost every course there was available. But they like to send us to those things. They plan meetings in like Chicago and all over the place for us to be able to continue our education because our technology is ever changing.
Nice. Perfect. Thank you. And like I say, if anyone has any questions, you can just pop those in the chat. Moving right along, Danielle, explain what systems or processes are in place to ensure that consistent and high quality patient care across the different locations. I know you mentioned that you are a float hygienist and we have over 1,000 offices across the country. What's in place for us to create that consistent and high quality patient care across our different locations, would you say?
So all of our offices use pretty close to the same technology. We use 3D scanners to make sure we're showing patients in real time what we're seeing in their mouth. That way we can talk to them about that. We all follow the same American periodontology classifications. We all plan the same antibiotic placement, the local antibiotic placement for periodontal therapy for infection patients. Um, Everything is very similar because typically in that area, one lead hygienist is training the hygienists that are spreading through that area. And then we all follow the same training online on the Aspen Tag U university page.
Yeah.
So it's the same exact training that everybody is reading and everybody is expected to follow for their 2 to 3 week training period.
Okay. Very nice. Very nice. I like that. I think that the AAP guidelines are critical and it's good to follow that. And that also keeps us away from those bloody prophies that I regret having to do in some cases. I have a question here in the chat. Going back to Aspen's willingness to provide tools, resources for hygienists, is having an air polisher purchased for my office a realistic possibility? I am a huge advocate for air polishing. What do you say to that, Danielle? If the hygienist would like to have an polisher at her disposal or his disposal, is that something that they can use that budget for that you're talking about, or how does that work?
So typically, yes. So the most I would recommend is talking with your RM, or even if you have a good relationship with your owner doctor, have a conversation with him or her. I just spoke with my POP and asked him for the Sidekick um, sharpener,
Sharpener. Yeah.
and because it's not available for me to purchase through our requisition. So it's something that I do have to have that approved, and he has that on order for me ASAP.
Very nice. I have another question for you, Danielle, from the chat. How long does it typically take to become proficient with Aspen's EPMS system? It's our closed system, if you're not sure. Aspen has a closed system so that we can correct things in a way that we need to as quickly as possible. We have a dedicated IT team that works alongside with helping with the EPMS system. And that's something that, I think it's good having it closed. I don't know if any of you know, but in 2023, we were victims of not really victims, but the cybersecurity hacker kind of got toward us. There were other large organizations that had that same thing happen, but the question is, how long does it take to be proficient with that system?
So that's a great question. And it's a really good opportunity for me to answer that because I have a hygienist who literally her first day was today. There was not a lot she could do in the Tag U video learning because her like I-9 hadn't been complete and whatnot. However, by the end of the day, she was scheduling my patients for me. Very user friendly. She was completing my notes. She was programming in the next cleaning. And I mean, she had only spent 7 hours with me and was already by the end of the day scheduling those patients. So it's very
Yeah.
user friendly, much easier than any software I've used. And I've used quite a few.
Yeah, yeah. It kind of puts me in mind. I don't know, Danielle, you got some years on you here of a platform called Open Dental. And
Yes,
so it kind of puts me a little bit in mind of that. I've used several of them, but that's the one that I closely associate our system with. Um, and it looks like in the chat, Lori says, after 14 years of dental hygiene, computers are my difficult part of the job. I learned it pretty quickly, very user friendly. And to be transparent, I'm very computer illiterate. I mean, I'm computer competent that I can turn the thing on and use it for what I need. But whenever you are using a system to basically replace a chart, right? This is a legal document, right? I love the platform that is created with our system because you can create templates. Is that something that you use, Danielle? Templates to kind of help
absolutely.
hone what you put in those legal notes?
Absolutely. And all of our hygienists have pretty much the same template. We just tweak it a little bit to our liking and our wording, and then we just kind of fill in the blank with what that patient specifically needed or had going on. It is extremely user friendly. It takes me less than a minute to do a note at the end of the appointment. So whereas like when I would use Dentrix, you have so many buttons to click. Takes 10 minutes to finish a note because you got to
Yeah,
click through all these to build that template.
yeah.
The template is already made for you. It's 2 buttons and your note is complete. It's so easy.
Nice. Well, I hope that helps with the question for that. I honestly want to add that it depends on the person too, because I know that it would probably take me a little longer than your new hire that just took her one day. I'd have to write notes, to go home, rewrite the notes, look at a computer, take picture. I mean, every learner is different, but the good thing is consistency has always been a strengthener of competency. So the more
Yeah.
consistent you are with using it, the more competent and confident you'll be in using the technology. And that's with any technology. It just depends on how often
And I
you're able to
think
use it.
to kind of add on to that, it's really about more hands-on versus me telling you what buttons to click. It's me walking you through, allowing you to click those buttons. I think that is the big separator, is what helps people really absorb how that the system works. Is if I go through and click and just show you, you're not going to absorb it. But if you're doing it as I'm walking you through, it stays a little better.
Yeah, I agree. I 100% agree. All right, next question, Danielle. How does Aspen Dental handle communication and collaboration amongst the dental team, including the dentist? You kind of hit on it already too, the hygienist and the administrative staff, because sometimes I think that there is a little bit of a disconnect with like it almost seems like every part of a dental office get this is my part and this is my part and this is my part. How does that all work with communication and collaboration among like the doctors, hygienists, assistants, and the front desk team to make sure that patients get the care that they need and that everything runs smoothly?
So the biggest thing is each hygienist has their own preference. Let me rephrase. Each clinical provider has their own preference on how much time they need for each patient. It's patient specific. So we all have a list of what our preferences are, that all of our front staff who are helping schedule patients, they all have that information.
Oh, nice.
Yes, it's great. We fill those out as on our first day of hire. That is the first form that we fill out because we want to know how comfortable you are with your patients to provide them with that excellent care. We don't want you rushing. We don't want you feeling burnt out. We want you to be able to provide the excellent care we know you're built for. So every hygienist, every clinical provider is given that sheet to fill out. The front staff abides by that. They know which column you are. They know how long to schedule that patient for. And if you're noticing that it's not happening, you get to have a sit down. We're so open that we sit down monthly, sometimes every 2 weeks, and just kind of touch base. Hey, we're noticing, we're not having enough time for a full mouth cleaning, or we're not having enough time for a Profian exam. We're noticing that they're shortening those. So we're always having meetings together. We're always open conversation, because holding a grudge or just being spiteful in the back and being angry in your operatory is not going to fix the problem.
Yeah,
So having that open conversation, joining together, knowing what our expectations are as providers throughout the office, and what the expectation is from the front to the back is also imperative as well. Making sure that the scheduling coordinators and the office managers, they know why, because if they don't know why, then they don't understand. So they're just like, it's just a cleaning, it's just
right.
this,
Yeah.
because they're not clinical. They don't know much in the back. So we like to have sit down monthly conversations, how things are going, what do we need to work on, what has been going great, what can we change to be better. All those things are just open conversations. We host huddles in the morning to talk about, ask the DAs if they have questions about scheduling, or why we're doing the things we're doing as clinicians,
That's
and
awesome.
leave that open for them to ask questions and see what needs to, how they can help or how we can help them.
Yeah, that's really great, Danielle, because I think that that is what makes a great team. Like if you can have open dialogue and conversations with people, just, understanding that, not everybody, like most front desk personnel don't have the clinical part, and you have to bear in mind that some people come from offices that, they basically created profi mills. And so they have a mindset. So it's everybody learning and then just having that kind of conversation. I love that as a team approach. And that actually is something that to me is critical for patients to feel when they walk through the door that there's a cohesiveness with the office that is just unmatched, that they're going to get the care that they need from front to back. So
Exactly.
thank you. Thank you very much. Final question, Danielle. What are three key characteristics or attributes for emerging hygienists to be successful with Aspen Dental and overall? I put these in here just in case people needed to have that visual. But Danielle, can you explain a little bit about all of these different um, characteristics or attributes that you shared with me earlier?
Yeah, so being motivated, not just motivated for the income of a hygienist, but being motivated for the education of a patient, knowing that you're helping them keep their whole systemic body healthy, being motivated to know, maybe you have a short amount of time that you have no patient, or somebody fell off, or your schedule's kind of falling apart, being motivated to say, hey, yes, I can help you today. I can get you in my schedule today. We can get that infection under control right now. Knowing that getting those patients in the chair sooner rather than later, if you can do it before they walk out the door, they're more apt to say yes to us, to get that infection under control, to get that periodontal therapy started, to invest in their health. Because a lot of times once they walk out the door, they start questioning themselves. Why am I paying for this? Why am I doing this? What does this mean? And then they sometimes change their mind.
Yeah.
Being flexible, like you were saying earlier, kind of, we have a lot of locations. Sometimes a hygienist calls off sick. We try not to, but being flexible with your hours, with your availability, with your self skills, being flexible in what you're capable of doing. We had a patient yesterday that is going out of country, going to be out of country for the next 6 to 8 months. Don't trust outside of the US medical providers, and was like, I really, really need to get in for this cleaning. Can we get this scheduled? So I was very flexible with getting it scheduled right away. I'm like, yeah, let me work my schedule a little bit. Let me flex some things around and help get you in that schedule to help you out. And open-minded, just not having the mindset of, I'm I'm a hygienist. I'm here to clean teeth. I'm here to educate my patients, run my column, and focus just on what I'm supposed to do. Being open-minded to know that our team needs help. Sometimes they might need a phone answered. Sometimes the dental assistants may need your help flipping a room. Being open-minded, knowing that you're part of a team.
Perfect. Thank you so much. That was super helpful. I hope you all felt like these nuggets that Danielle provided was super helpful. I hope that it helps you on your journey as you continue to be the best clinicians that you can be. Right here, I have my information down, my email and phone number, and I have Danielle's email down. Please, no matter what, ask us whatever questions you need. We're all here to help anchor you to be better clinicians over time. And from here, you can only be better and better and better. It is one of the greatest professions to be in, and I'm so grateful that I was able to be part of it. I'm happy to have people like Danielle. So thank you so much, Danielle, who's taking her evening, to kind of just share her nuggets and her wisdom with us. So thank you so much.
You
With
are so
that being
welcome.
said, thank you. With that being said, I just want to share that the winner of the $100 gift card is Natalia Carrero. Congratulations, Natalia.
Congrats.
I'll connect with you offline and get that sent to you. Otherwise, enjoy the rest of your evening. We look forward to the future in dental together. Thank you.
Thank you.